Hi guys, I'm going to tell you a little bit about cardiovascular conditions today that are relevant for your first aid training. And so I know this is just a little reminder because we would have covered it all before in our previous courses. So just a quick refresher, the heart is made up out of very specialized muscle tissue, which pumps the blood around our bodies in the blood vessels and supplies all the tissues with nutrients and most importantly, oxygen as well. And the heart itself has its own kind of blood vessels that supply it with nutrients and oxygens, which are called the coronary arteries. Like with all arteries, they can become inflamed and a little bit narrowed over time, and things might deposit in there like clots or kind of cholesterols and fatty tissue. And this results in narrowing of the arteries, which is called atherosclerosis. Um, this can also lead to a complete blockage of those arteries. And so if this happens in somewhere else in the body, perhaps the legs, this is called thrombosis, or maybe if there's an issue in the brain, this might result in a stroke. But when the coronary arteries, so the arteries of the heart, become blocked, then basically the heart muscle and the tissue of the heart does not receive enough nutrients and oxygens and begins to die. And this is a serious condition called a heart attack. So in medical terms, you might have also heard a heart attack being referred to as a myocardial infarct or an MI. So the typical symptoms for heart attack is a really heavy voice-like pain on the people's chest. It's not exclusive to the chest. It can also be on the shoulders, arms, back, or affecting the jaw. Sometimes it can be mistaken for indigestion. However, all the other symptoms that come with a heart attack are often not part of indigestion. And so furthermore, the person might experience shortness of breath. They often become pale and sweaty and clammy. Um, they might have a blue or grayish tinge to their skin, and their pulse might be normal or irregular. And overall, they will often experience some anxiety or fear, and which is often described as the sense of impending doom. The person might also feel sick or nauseous and in generally quite weak. So, as a first aid management, we want to calm the person down and reassure them and sit them down on the floor, perhaps, and their back resting on a wall, having the knees up so they sit in a W position. You would want to call for an ambulance and medical help. Whilst monitoring the person in their condition. So normally in the first aid context, we are not allowed to give or prescribe medication. However, the guidance has recently changed, and for a heart attack, we are allowed to administer 300 milligrams of an aspirin tablet, ideally crushed, which helps to interfere with the blood clotting and hopefully reduces the progress of the heart attack until medical help arrives at the scene. It's important to note that you are not allowed to carry the aspirin in a professional first aid kit, so people might tape it to the outside. And also, this is not suitable for people who are allergic to aspirin or other salicylates, which is the active component in aspirin. And also, aspirin is not suitable for people under 18 as it can trigger another serious medical condition. Whilst you are monitoring the person and waiting for help to arrive, it might also be a good call to see if you can arrange for a defibrillator to arrive on site. Maybe do it discreetly so you don't worry the person, but this could be useful should the heart attack progress into cardiac arrest and should you need to begin resuscitation. Another condition that is important to know about when it comes to first aid is called angina. And basically, angina um, is when the arteries, again, the ones of the heart, become restricted, and this results in a reduced blood flow and oxygen supply to the muscles of the heart. So, unlike at a heart attack, they're not fully blocked, but there's just a reduced flow due to the narrowing, and therefore the heart has to work much harder um, to supply that area with nutrients and oxygens. So usually angina occurs when people have had physical exertions or are under emotional stress, and it eases when people relax and stop exerting themselves. So the signs and symptoms of angina are again very similar to that of a heart attack. People will feel weak and faint, and they might feel nauseous and dizzy. There would be some kind of very sharp chest pain in kind of the heart area, and their skin might be pale, cool, and clammy. However, often the angina symptoms and the pain would start to ease and would be relieved once people rest and sit down and are more calm. So similar like you would do with a heart attack, you want to reassure the casualty and try to sit them down on the floor comfortably, possibly with their back towards the wall and their knees up again. People that are experiencing angina chronically, they would be aware of this. They would have been diagnosed at some point with this and probably carry a medication which you can help them to administer. And so this medication is called a GTN spray, which is an oral spray that is given into the mouth. Um, if the medication does not help after 5 minutes, a second dose can be administered. And if there's no improvement after 10 minutes or the condition is worsening, an ambulance should be called. An ambulance should also be called if this is the first time the person is experienced this symptom and has no history of angina.